was diagnosed in April of 2020, right at the time everything was coming to a halt. Had to go to surgery by myself. The breast cancer was on the left,
Yes.
but it turned out to be on the right also.
Oh.
So at that point, that was the first time I realized maybe she's not the right person for me.
Right. Okay.
And he kept filling it. And then what I found out when I saw the actual surgeon was that he had overfilled me.
Right.
But I didn't know. And then a whole infection began, then had to go back in and have the whole thing removed.
Now that time during pandemic, you couldn't have anyone with you.
No, not at all. You just go for everything. You're by yourself. He said I needed to get fat first.
Okay. Because you were
Cheesecake, pizza, spaghetti. Eat it.
That's terrible.
I knew that there had to be something else. And so luckily my beautiful therapist did some research and she found you. And I learned that that wasn't my only option. You gave me my life back.
Have you been diagnosed with breast cancer and you're thinking of getting breast reconstruction? It's really important that when you go meet with your plastic surgeon, you ask the right questions and you get the right information. In today's video, I'm going to share with you Angela's story and how she was diagnosed with breast cancer during the beginning of the pandemic, where everyone was isolated and wasn't able to have people support them. She's going to share with you a journey of having a double mastectomy, getting breast reconstruction, only for things to not go right, and what happened after we met. And we had a plan, and now she's here to tell the tale. So getting breast cancer is hard enough, and being diagnosed during a pandemic was way worse. Today, my special guest is one of my patients, Angela, who's here to share her story of what it was like being diagnosed with breast cancer during the pandemic when everything kind of came to a grinding halt, and her subsequent difficult journey with breast reconstruction. So Angela, thanks for coming in today. I know you're busy, I know you're working, but do you want to share with our viewers when were you diagnosed and how did things come about at that point?
I was diagnosed in April of 2020, right at the time everything was coming to a halt. I had felt a lump and made an appointment to get an ultrasound, and then was diagnosed and had to go to surgery by myself during that time.
Which side was your breast cancer?
The breast cancer was on the left,
Yes.
but it turned out to be on the right also.
Oh.
Right.
Okay.
Yeah. They only seen on this side through the machines because of my dense breast tissue.
Right.
And it turned out I had a small cancer on the right. So it was stage 3 on the left, invasive lobular carcinoma, and then stage 1 over here.
Right. And how did you find out about the other breast cancer?
I opted for a double mastectomy.
Right.
And by getting the double mastectomy, after the surgery, I was told that when you get the report.
That must have been a shock. So they send the tissue for pathology, and when they got the result, usually kind of a week or two after, they were like, oh, you have bilateral breast cancer.
Correct. And I didn't know much about that part.
Right.
Like if you could have stage 1 over here and stage 3 over here. But that I found that out. Right.
So it's a good thing you had both sides.
Correct. I was very lucky that I opted for the double mastectomy for myself.
Yeah.
Right?
Did they offer you double or recommend it or?
I went to one surgeon who just wanted to do a simple lumpectomy.
Right.
And for me, I wanted a double mastectomy. I didn't want to have to worry about the other breast for the rest of my life. And she was not on board. She felt like God had told her that I just needed a simple lumpectomy. And I thought it was my decision. So at that point, that was the first time I realized maybe she's not the right person for me.
Okay.
And I went to a different surgeon, and he was completely on board with my decision in getting a double mastectomy. And I always feel lucky that I did make that decision for myself because I would have been back in for the other one.
Right. And things could have advanced to further.
Right.
So that was great that you advocated for yourself early on.
Yes.
Now, when you had your mastectomies, you had breast reconstruction, correct? The same day.
Correct. The expanders, yes.
Yeah.
Yes, those were put in.
Okay.
Correct.
And was that the plan like you'd met with the plastic surgeon before the surgery and you had a plan going in?
No, I met with the plastic surgeon.
Yeah.
I met with the plastic surgeon the moment I was going in for surgery.
Oh, the same day?
The same day, like he just came and introduced himself to me.
Oh.
At that time, I had no idea what was going to happen. I didn't really know until I came out of surgery.
Right.
And so that's kind of where the darkness began.
Oh, okay. So in general, we do prefer to meet with the plastic surgeon and the breast surgeon and have a plan going in. Because there's often more than one choice of reconstruction.
Right.
So, but in your case, that didn't happen.
Right. I think at that time, I didn't know. I thought my surgeon had this perfect relationship with this wonderful plastic surgeon, and that was his partner, right? But
Got it.
Didn't turn out so pretty.
Okay, so tell us what happened.
So I had lost a lot of skin on this side because of the cancer, and so he could barely close my chest with the wound with the expander,
right?
And he stretched it so thin, and he was like, he managed to get it closed with the expander, and it was already very tight, tight. And this side was okay because that was just like a stage 1 and didn't lose any skin,
right?
And then you go and you get these fillers put into the expanders to expand, and that was the thing, so I could expand this skin over here. And he kept filling it, and then what I found out when I saw the actual surgeon was that he had overfilled me,
right?
But I didn't know, and then that's when a lot of the complications began. It started opening, and I had to go back into surgery, and he just kind of cut out this one little part,
right?
So I could get because I was then going to begin radiation.
Right.
He cut out this little part, and then a whole infection began. Then had to go back in and have the whole implant, the whole thing removed. So, a week later.
So you had your mastectomy. They put in tissue expander at the same time.
Correct.
And then within a week or so, you had a bit more taken out. Was that in the office or was that in the operating room?
That was in the operating room.
Okay, so that was your second surgery.
Correct.
But then soon after that, you got an infection and you had to have the expander taken out.
Correct.
So that's surgery number 3.
Correct. Just before radiation.
Okay. Then you got your radiation. And how much radiation did you get?
6.5 weeks of everyday radiation.
Okay. Now that time during pandemic, you couldn't have anyone with you.
No, not at all. You just go for everything. You're by yourself.
Oh, that makes it so much more awful. Sorry you had to go through that.
Thank you.
And then after the radiation, what happened after that? Because now you didn't have an expander, right? On the left side.
On the left side, right. Yeah. And the skin changes.
Because very tight because of radiation.
You're correct.
Yeah.
And so it changed what it looked like. And then plus I had 2 surgeries after the surgery.
Right. You had more tissue taken away.
Correct. And more damage. More scar tissue. Correct. But I didn't know how bad, it was pretty bad. It was pretty bad. And then after radiation is over, I had to wait a period of time, like a year.
Usually 12 months, yeah.
Correct. And at that time, he was telling me, I kept wondering when I was going to have my surgery.
Because you had to have more surgery, right? To make you a new breast.
Correct.
And to replace all that skin.
Correct. He was telling me I had to have the tummy tuck. Right, I was getting a free tummy tuck is what I was getting.
Okay.
But I was going to be getting the free tummy tuck, and then this was going to be the deep flap with the fat.
Yeah.
With fat put right here, but I had to have an implant over here because he said I didn't have enough skin for both sides.
Okay.
But he said I needed to get fat first.
Okay. Because you were
cheesecake, pizza, spaghetti, eat it.
That's terrible.
I couldn't imagine. I don't know how much weight he wanted me to put on. Every time I kept going in, he kept telling me, you need to eat cheesecake, pizza, spaghetti.
Oh, God.
All right?
For one breast.
For one breast. Yes, for one breast. And the other one had to be an implant. And I kept thinking, every time I go, he's telling me cheesecake, pizza, spaghetti, eat it and get fat.
I mean, I'm laughing because it's so horrific.
Right. And he's only white, and he doesn't realize, I put on fat everywhere. Like, it's like my legs or my arm. But he only wants it in my stomach. And that's just not how that goes. Right. And so I was like, I thought to myself, well, thank goodness I had therapy. I had a therapist, and I would tell her, like, what happens if you can't gain weight? There's women that can't gain weight. Or I knew that there had to be something else. And so luckily my beautiful therapist did some research, and she found you. And I learned that wasn't my only option. The tummy tuck and cheesecake pizza spaghetti. And I'm grateful for that.
So we basically did the latissimus flap, had one surgery with an implant, and you stayed one night in hospital. You had a really good recovery. Right. And everything went well.
I didn't have to get fat. And I didn't have to have that vein, like all the trauma to my stomach or the vein, all the different things that happen when you have, that they don't tell you. Right. That they make you think it's just a tummy tuck in it, that every woman wants, right? Yeah. But they don't tell you all of the things that come along with that. Right. And you told me all those things, and I was so grateful. And I knew there was another way, and the latissimus was so much better for me, for sure.
So, Angela, I want to just go through the latissimus flap and your experience. Because remember, you were going to fan up to get a flap on your one side and an implant on this side. So you were never going to be symmetric.
No.
So tell us the experience of having a latissimus flap. And what was it like for you?
I don't want to say it didn't hurt, but it didn't hurt because of the things you did. You gave me a blocker.
Right. So I block all the nerves. It's an intercostal block, and I use a long-acting anesthetic that lasts for 5 days.
Yeah, it was good.
So
it worked really
well.
well.
Back.
Right. And I feel like I had no pain other than just I guess just aches and pains, but not like I could lay down. Yeah. Like that was fear. I was like, what am I going to do? How am I going to lay down? But you're like, oh no, I'm going to give you a blocker. And I was like, oh. And of course, I don't really know what that is, but it was great. I'll forever remember the blocker.
Yeah. Well, people always, when I tell them, hey, I'm going to move the tissue from your back, they're horrified. They're like, can I lay down? That's not no.
That was my first thought too.
Right. And then the other thing is, can I move my arm again? I was like, yeah, you can move your arm. Right. So it was a very positive experience for you.
Very positive. And I feel like I didn't lose anything. It's just like a little small line across my back, and my bra covers it. Right. And it was like a skinny back type thing too.
Right. Well, the thing is, we have, people that are heavier than you that have rolls on their back.
Right.
Okay. And so what I wrote up was basically what's called a bra line back lift combined with a latissimus. So they get the flap to make the breast, and they tighten up their back as well. Right. So, you didn't need to tighten up the back, but your scar is nicely concealed.
For sure.
And that makes a difference.
Definitely. Agreed.
Right.
Yeah, and you don't know, I don't notice it, and I don't notice it at all, whereas it would have been a great loss to lose all my stomach muscles.
Right. And then also, the other thing is it's mashing, because you already have an implant.
And that was the most important thing for me, because I thought, how could like the symmetry. That's why that's one of the big reasons why I wanted the double mastectomy as well. Right. Right. Yeah. That's a big deal.
Because with a lap and an implant on one side, it matches the implant on the other side much better than if you've gotten the DIEP flap.
For sure. Yeah. Yes. I know we're never the same after, but you gave me my life back. I feel, because we see there's the before cancer and then there's the after, and you feel like a bomb has exploded on your body and your chest. But when we come to you, you put us back together. I felt put back together in the best way that I could have ever hoped for sure. And I can't imagine. I'm just so grateful that I left that other guy and didn't eat cheesecake, pizza, and spaghetti because, and it
made no sense to you, did it?
No. And I think the important thing is listening to ourselves and realizing that just because we're given a surgeon or a plastic surgeon or somebody doesn't mean that that's the right one for us.
Right. Because you already did that with your breast surgeon who wasn't right for you. And probably saved your life, right? Because you've got the other diagnosis, and then you managed to take yourself out of the plastic surgeon who's fattening you up to give you a...
But it doesn't help you either, right?
Absolutely not. Everyone knows for research that obesity is linked to breast cancer. So making you fatter isn't helping that at all.
No. And I'm just glad that I had a therapist or people around me to help me realize that's not the end-all be-all person. There's more.
Now, looking back now, because we're 5 years out now, would you have done anything a little different? Like if you were advising a friend now who just got diagnosed?
I would have never let that surgeon keep filling me up, right? I just didn't know. I would have done more research on my reconstruction plastic surgeon, like finding you before. And not letting all the... I mean, I don't know if you can ever really know, but I'm just grateful that I was my own advocate. And I didn't have to feel bad leaving him or feel tied to him. Right? And I had no loyalty because he was doing cheesecake, pizza, spaghetti. Right?
I mean, that, to me, it makes no sense, really. Because, and the other thing is, you know what really bugs me sometimes is hearing that surgeons, they only tell patients what they want to do to that patient, who's usually a woman, without telling them, here are the options. You know, so he was very stuck on, I'm going to fatten you up to get a deep flap, because I want to give you a deep flap.
And I couldn't imagine if that was the only option. And that's what my mind kept telling me. Like, that can't be the only option. And I'm glad that I listened to the voice, realizing that isn't the only option, because when I came to you, I got to see all of my options, and I was told all of the things that could happen, like things that he doesn't tell you. It's kind of like, oh, it's a tummy tuck. They make it sound so beautiful, but they didn't tell me about this, that like a vein,
the vessels that are involved and the complications. So it's really, you bring up a really important point, because when you meet with a plastic surgeon or any surgeon really, they should tell you all the options, not just the things they want to do, and the complications, the pros and cons of everything, and show you photos. I mean,
I didn't see photos. I didn't even get to see him before surgery. But he had nothing to show me.
After that, when you were going in for your expansions, I mean, were you talking about it then?
I was just, he was just telling me what he was going to do, what I had to have done, right? And there was no options. There was no other options. And I just needed to get fat. And I couldn't imagine that. I know there's women that no matter how much they eat, they can't get fat. And that's what I was thinking to myself. I know I could get fat, but I know I didn't want to get fat because it's not easy. You're just going to take my stomach away. It's not easy to lose the rest of the weight and to recover. I'm already recovering with my strength from that. And so I just thought that can't be the only way.
Well, places like Asia, where you know the typical woman is very, very slim. The latissimus is the commonest way that breast reconstruction is performed. Because women just don't have enough there, and they can't all go get fat. You know, so it's just strange that you needed to know all the options, and that's a really, really important message.
Definitely.
So if it feels right, then stay with that. But if it doesn't, go get another opinion.
100%. And 100%. And you have to have confidence and faith in the person that's going to cut you open. And I didn't have faith in that at all. So I'm just glad. I agree. Be an advocate for myself. I think that's important.
So Angela, tell us, how's it been for the last couple of years now since you've got the surgery and you've made some recovery, right?
Yes, it's been very good. Life is so much better, and I feel more confident. I feel like I'm myself again. And I think that was the one thing that cancer sort of takes, is you're like part of you, right? And now and you put me back together. So I feel put back together. That's just what I feel. And then slowly you just get confident again.
Because I know you went to a different job, right? You had your job at
Yes.
Was it Home Depot?
Yes.
Right?
Yes. It was just to get out after COVID.
Right.
During my recovery.
Human contact.
Yeah, human contact. And that way I could have all my surgeries, right?
Right.
And it worked out well. And now I have a good job and I'm happy.
Yeah.
And life is like, it's interesting how life slows down during cancer, but now there's never enough hours in the day, right? Yeah.
Well, that's
so much better. It's
Yeah.
so much better.
Right.
Yeah.
Because there's the life before.
Yeah.
And then it hits you. And then you spent considerable amount of time being put back together.
Right.
And then there's the after, the afterwards.
Yeah.
Right.
Yeah. And I just feel put back together and like whole again, for sure.
Well, thank you so much for coming today to share your story. And hopefully women can learn from you. If it doesn't sit right, it's time to get another opinion or see someone else.
Definitely.
Right?
Yes.
Because you saved your life, probably, from the breasts.
I couldn't imagine.
Right.
Well, I'm just so grateful that I didn't feel a sense of obligation to stay with a doctor that I didn't feel was right for me. And that's, I think, the takeaway, that if it doesn't feel like the right doctor, it isn't.
Yeah.
Yeah. Because I never felt that with you.
Yeah.
I was always felt like, where have you been all my life?
It's so sweet.
Thank you.
Yeah, we do spend a lot of time laughing and having a good time now, which is
do.
good.
Yes.
And that's a good thing.
Yes.
So, yeah.
And laughter is healing too.
Yes.
Thank you.
Well, thanks for coming.
Thank you.
I'm Dr. Wai-Yee Lee. I'm a board-certified plastic surgeon. I'm originally from London, but I now have my all-solo practice here in Los Angeles, LA Breast and Body. We specialize in breast reconstruction, breast revision surgery, as well as cosmetic surgery of the breast. If you found Angela's story to be inspiring, please hit like and subscribe to my channel. In future, I'll be sharing more patient survivorship stories, as well as continue with breast education videos, which is the theme of my channel. Please check out our website or give us a call, and I hope to see you in the future.